From Awareness to Action, the Power of Advocacy and Health Equity. So we want to now welcome Cheryl McDermott. She is a seasoned policy and advocacy expert with over 20 years of experience championing critical issues related to health disparities, access to care, and social detriments of health and policy. She is currently serving as the Director and Strategy Alliance Leader at Bristol Myers Squib. Ms. Cheryl McDermott.
So good morning. Good morning, DC. How's everybody feeling this morning? Awesome. Well, I am honored and delighted to be here this morning for this exciting and transformative health and expo. And my name is Cheryl McDermott. As mentioned, I am Director of Strategic Alliances with Bristol Myers Squib. And we are all gathered here today to embark on a journey that delves into the fabric of the community's health landscape, understanding that reliable access to healthy food and medical care in a safe environment are the basics for good health. Many of you know the surprising fact that your zip code has more impact on your health outcomes than your DNA. And everybody's shaking their head because that is quite alarming. As a biopharmaceutical company, Bristol Myers Squibb is driven by a single vision: to transform patients' lives through science. Because every day, in every state, in every city, including right here in Washington, D.C., and every country around the world, patients are waiting. They're waiting for relief from the fears and burdens of illness and disease. They need hope that tomorrow will bring forth improvement and change. Most of all, patients need answers, medicine and treatments that can change their lives for the better right now. BMS is proud to have committed grants to independent patient advocacy groups, community-based and faith-based organizations, medical societies, healthcare nonprofits, to start and expand community health worker and patient navigation programs. These grants to independent organizations assist patients with social care needs, such as transportation to clinics, financial assistance, housing, healthy food, as well as guiding them passionately through complex clinical care journeys. So from aware to action, which is what our title of our session is today, we're here to explore the power of advocacy in advancing health equity. I encourage everyone to confidently share their personal and caregiver journeys with their peers, with local community, as well as with policymakers. Communicating the lived patient experience is crucial for fostering significant advancements, particularly in the realm of health equity for future generations. The diverse patient experiences concerning healthcare access, adherence, and affordability are profoundly effective, especially considering the disparities that exist amongst different patient demographics. Embracing the wisdom of the African proverb, if you want to go quickly, go alone, but if you want to go far, go together, can inspire collaborative progress. Through our collaborative efforts, we have the power to dismantle barriers, amplify voices, and foster a future where health and wellness are accessible to all. Let us remember that the voice and each of our voices, each of our perspectives, is an integral piece of the puzzle as we strive for a healthier and more resilient community together. So I thank you all. Thank you for your presence here this morning. And here's to a day filled with hope, empowerment, and the promise that we'll have a brighter and healthier future for us all. And now I am going to turn it over to Roslyn, who's going to introduce our Honorable Representative Glen Ivy.
Now, did I all tell you that our logo for 2024 is I vote because Black health matters? All right. We are so honored to have Congressman Glen Ivy with us. He is an accomplished attorney and has served on Capitol Hill in various capacities, including Chief of Counsel to the Senate Majority Leader and counsel to Senator Paul Sarbanes during the Whitewater investigations. Congressman Ivy is a tireless advocate and fighter for our community. Welcome.
Thanks for that introduction, and good morning. Y'all are out early on a Saturday morning here. I appreciate that. I did want to thank Bristol Myers Squib for putting this together, and I wanted to give a shout out to Mignon Clyburn, and there she is, for showing up. So thanks to both of you all. And I also want to mention two things. We've got CBC Spring Health Brain Trust coming up April 29th through the 30th. At the Watergate Hotel. Robin Kelly, one of my colleagues from Chicago, is heading that up. And then the CBC Foundation, CBC is Congressional Black Caucus, just in case. Policy for the People Health Equity Summit, May 22nd at the Westin Hotel in Washington, D.C. I feel a little awkward being on this panel because in some ways, I'm not exactly the poster child for great health. In fact, I'm probably the other side. So I'm originally from Rocky Mount, North Carolina. Yeah, there you go. And as a Southern black male, that means I have, not because I should, but I do, high blood pressure, high cholesterol. My father died from Parkinson's and Alzheimer's. My grandfather was a chain smoker, so he was taken out by lung cancer. Mom went with a stroke. What did I forget? Oh, me, kidney cancer. So I've got 6 kids. Now we stopped a while ago now, though. You know, I'm not in the NBA. You know, I didn't keep going. But my kids like to tease me because you know, my wife, on the other hand, has none of that stuff. And her father's from Goldsboro, North Carolina. Stepmom's from Asheville. So we've got both North Carolina roots, both Southern African Americans, both very different health patterns. And part of that is based on the fact that I do things I shouldn't be doing. Mainly, I eat things I shouldn't be eating. But I am trying to do a couple things better. And I'll get to the policy thing in a minute. But I wanted to lead with the confession, okay? I wanted to be clear that I'm not talking down to anybody in here. I ain't better than anybody in here. A lot of the things we're trying to do through these policy outreach efforts are aimed at people just like me who are doing things that are slowly killing ourselves. And we need to change that path. So one of the things that we've tried to do, I just got elected to Congress last year. Way before that, I was state's attorney in Prince George's County for 8 years. Well, I'm not going to get on gun violence today, but that's a huge problem in our community too. And underneath that is mental health. So that's a whole different conference, but our community really needs to address that. But I did want to touch on a couple things real quick. One is the evolution of the healthcare issue from a policy standpoint. And I want to go back to Obamacare. And yeah, I don't call it the Affordable Care Act, I call it Obamacare. Because I want to make sure that as we go forward on this, people know who put that in place. I think it's important to remember, yes. Now, a quick piece on the politics of that. So one of the pieces that was there was they would provide additional funding to states. I think it was like 90% if the state kicked in 10% to expand. I think it was Medicare coverage. So what happened was you had red states, many of them still to this day, refusing to adopt it, even though you'd be saving thousands of lives by expanding the coverage to cover additionally millions of people simply because it was connected to Barack Obama and the Democratic Party. right? Fast forward to COVID, same kind of deal. You ended up with a scenario where Donald Trump told his community, Republican voters, I don't want to get too political here, but in the world today, there's no way to avoid that. But Trump told them, basically, this is all overblown until he got COVID. Then all of a sudden, he went to the hospital, got all the treatment, right? But for everybody else, he told them, you don't need these vaccines and stuff. So what you had happen was in some of those states, white mortality surged ahead of black mortality just because of the politics in their mental state, right? On the other hand, African Americans, after we found out what was going on with this, we were like, where is that vaccine, right? I ain't never got that many shots in my life, And so the moral of the story, I think, is that politics matter, what we say to each other in our communities matter, and that includes the Divine Nine, that includes the faith community, that includes any other possible angle where we can spread this message. And the message is sometimes uncomfortable, because I'm a BMI 30, right? I'm not proud of that, but it's real. And one of my kids just the other day called me up, and we were talking, and he's overweight too a little bit. And he said, Dad, you and me, I know, don't get upset about this, but we need to start working on this. We need to start working on it. Now, the deep thing is he's 28, right? And I'm 63. He's telling me what I need to be doing, but he's right. And the reason he got serious about it was, talk about a busy year, he got a new job, he got a house, he got married, and now he's got a baby on the way. And he said, Dad, it's time for me to get serious. And he's right. And so it's not just his time to get serious, our whole community needs to get serious. Conferences like this are a huge step in the right direction, spreading the right information, making sure we talk to each other. And we have to assist each other in this too. Just like my son reached out to me, we need to reach out to each other. The buddy system makes a difference here. When we're trying to do things, stay on that exercise regime or lose weight, or, I'm from Eastern North Carolina. That pork barbecue, man, it's hard to turn that away. It really is. So I'm trying to cut back. We're trying to do a little. We had a healthcare expo out in Prince George's a couple weeks ago, and we stopped at a vegan restaurant. And I just knew I was going to hate it, right? I had to go and eat because, the guys were there with the photo thing, so you got to eat it and smile. But it turns out it was actually pretty good. I had no idea what I was eating. And I started to ask, and my wife said, you don't want to know. Just keep going. But we have to test these things out. I know we're sort of in a pattern where we continue to do things, and in the back of our head, we know they're not great for us. And we have brothers, sisters, children, parents that are doing the same things. We got to make sure we reach each other and love each other and work our way through this together. And then in the politics of it, and it is 2024, and I am a politician, and this is maybe the most consequential election of our lives. It's funny because I've been saying that, every 2 to 4 years. It's a big election, it's a big election. Well, it's really consequential this time. It really, really, really is consequential. Yes, thank you. We need to get out there, and I'll just stay on the healthcare piece of this. Keep in mind that after the Obamacare passed, the Republicans had 50 votes to try and eliminate it. And they're still trying to do it. They're running into problems now because white America in the red states is like, well, I don't know what you call this stuff, but it's kind of helpful here. Grandma wouldn't have got that medical treatment but for that. So they start calling it different stuff. In Kentucky, they call it Kentucky Care. Anyway, but we can't waste time with them tricking themselves, right? Because we're the ones on the front lines with this stuff. We're the ones that die faster most of the time. And I'll end on this particular note here. Black maternal health care. When Venus Williams, Serena Williams almost died in childbirth, and they started talking about, well, maybe this, and I'm like, she's like maybe the greatest athlete in the world right now, right? And then you had, I think 3 Olympians? So there was the Olympic gold medal team from the last Olympics. I think one of them died, and then 2 almost died, right? And so you know it's not because they're not in good shape. It's the difference in the treatment. And we know that's the case because it's true in other scenarios too. Across the street from me, a kid grew up who had sickle cell anemia. And when it flares up, it's like being tortured. And so he would go to the hospital, and they kept telling him, no, we're not going to give you painkillers because they didn't say this part, but we know you're black and you're here just to get the painkillers. You're going to use them or sell them. You're abusing this stuff. It's different for us. So we have to make sure that the people in charge, whether it's in politics or heading up the healthcare system or running hospitals, they have to know that we will hold them accountable. And in 2024, in November, this is a big chance to send a big signal that we will hold them accountable. So let's hold ourselves accountable. Let's hold our families accountable. Let's hold elected officials and leaders accountable in 2024. Let's make a difference. Keep up the great work.
Thank you so much, Congressman Glen Ivy. I know that vegan cuisine is an acquired taste. I'm glad you enjoyed it. Next, we have Dr. Jennifer L. Ellis. She is a board-certified cardiac surgeon. You know why that's important? Yes, you know, like 15 years ago, to find a black female cardiac surgeon was very difficult. It's a rare breed, so when you have one, celebrate her. She completed her surgery training at Lincoln Hospital and her cardiothoracic training at NYU Medical Center. In her more than 25 years of experience, Dr. Ellis has been an advocate for underserved minorities and women, especially in the field of heart disease, and has volunteered in Ethiopia, Fiji, the Philippines, and for the Indian Health Service. We welcome you. Welcome.
I appreciate you. My grandmother appreciates you. All right, you know, we've had a bit of a day today, you know, already, so I want everyone who can to stand up, and I'm going to have you earn back your seat. All right. If you did not know your grandparents, all 4 of them, because they passed away before you were born, have a seat. No, if you did not know all 4 of them, because they passed. Yes. If you don't know what your cholesterol is, have a seat. If you don't know what your blood pressure is, have a seat. If you know that if you take medication for your blood pressure or your cholesterol, have a seat. Now this one's a little bit ugly, so everyone keep your eyes straight forward. If you could lose 20 pounds, have a seat. If you could, if you should. If you smoked, or if you lived around smokers, have a seat. So I could actually, with 2 more questions, I could get everybody, but that's good enough. You can have your seat. But if you notice, cardiovascular disease is the #1 killer. So if you had to guess, how many people do you think have breast cancer every year? Shout it out. No, the number. No, not 1 out of, like, 10,000, 20,000, 100,000. We're hearing 30, 40, 40, 30. Okay, we got an idea. How many women do you think die of heart disease every year? in the United States. So guess again. So if you said breast cancer was 60,000, you're saying 60,000 for heart disease? We hear a double that. So about 50,000 women die every year of breast cancer. 500,000 plus die from heart disease. Even if you have breast cancer, you are more likely to die from heart disease than from the breast cancer. There's more heart disease than breast cancer, colon cancer, lung cancer, prostate cancer, accidents, HIV combined. And we aren't taking care of ourselves. I mean, I heard the previous talk talking about knowing your A1C. Did you know that more women have heart disease than men? Mm-hmm. And so that's the other frustration. So if you're a black woman, you're more likely to have heart disease than a black man, more likely to have heart disease than that white woman, more likely than that white man. And guess who gets the least amount of services? Who gets less likely to get the cardiac catheterization, the medications? Being actually, when they go in with the chest pain, saying, oh, it's nothing. And it's like, no, it was your heart attack. Less likely to get an operation. So these are the kind of things that we need to advocate for ourselves and advocate for our politicians. We had a politician here who's actually understanding this and learning and educating us on how important some of these things are. But so how do you advocate for yourself? So now let's say you go into the emergency room because you have some chest pain. You're just not feeling right. And they're not doing this on purpose. They are not bad people. That ER doc is just a product of the environment and of his upbringing, and he is not hurting you on purpose, but he is not necessarily thinking that you have heart disease because that's just not in his matrix. So part of our job is to educate him a little bit. So the education is when he says, oh, I don't think it's anything, you should say, could it be my heart? And he said, no, I don't think it's your heart. And then you say, but could it be my heart? And he's like, well, no, I think it's just a little bit of GI distress and I want to give you some Pepsid and let you go home. And then you say, but could it be my heart? And he's like, no, I'm pretty sure it's not. And then you keep saying, but could it be my heart? And eventually he will go, maybe it's your heart. I mean, mental illness we were talking about, I had this one patient, she thought she was having a heart attack. She had a history of mental illness. She thought she was having a heart attack, so she pulled the fire alarm because no one was coming to help her. So they brought her in to the locked psychiatric ward. And when we saw her on Monday, because it was over the weekend, we heard her symptoms, and we walked her over to the cardiac care unit, found an empty bed, put her in it, and then said, you need to work on this heart attack here. She had 3 days without treatment or therapy, and because of the stigma of mental illness, after they had treated her heart attack, they came back and said, we're done with her, does she need to come back to the locked ward? And we're like, no, she should have never been there. There are times, the flip side of this is if you do go into the ER and they've checked your EKG and your blood work and the x-ray and the echo and they say, it's not your heart, you can go, oh, okay, it's not my heart. Thank you. But until they actually do those things, those are the kinds of advocacy that we have to take care of for ourselves. Now, this audience is a little bit more female than male, so one of the other things with women, we get into trouble because sometimes our heart attacks are presented differently. Sometimes we don't call it chest pain, even though it actually is, but we don't want to call it that, so we will call it feeling a little bit of pressure. My arm is a little sore. For the Italians in all of us, it's just my agita. But that we have to also present that to them, and they have to be aware. So we also are notorious for minimizing. And how many times is a woman getting a heart attack, and then she'll go, well, I need to go to the hospital, but who's going to pick up the kids? There's dry cleaning, the stuff is on the, the crock pot is on the counter, and I got to get somebody to turn that off. Whereas our brothers, our husbands, our fathers, our sons are smarter about this, only this. And they will say, ow, and go straight to the hospital. Time is muscle. And when we talk about cardiovascular disease, we're also talking about stroke. Did you know now we have treatments for stroke, that it is not this permanent issue? And if we can get there within the first couple of hours, we can save your brain. And if we can't, it is dead and dead forever, that chunk. And so if you have a TIA, so you know you have something that is wrong, if you go and we can nip it in the bud, it will change your life. It'll change the possibilities of disability. So we need to be our own advocates. We need to go in when we go to the doctor. We need to do some of those routine things. No one enjoys a colonoscopy. Nobody. I've had mine. The best part about it was leaving. And actually, the meds that they give you, they're pretty good too. But the difference is, seeing somebody who's dying of colon cancer when it was completely avoidable. And you want to be mad at them, but they're paying too big a price. If you are a smoker, we now actually do screening for lung cancer. Mammograms, PSAs. Our guys sometimes it's like, I don't want anybody testing for my prostate. I'm like, you'd rather die from it? No one enjoys a mammogram either. I mean, you guys think a prostate exam is bad? Try a mammogram. Yeah, but if it saves some lives. Same thing with the heart. Once you hit about 50, 55, you should be getting a test. And it could be a stress test where you actually run on a treadmill. If you can't run on a treadmill, we'll give you some meds to make your heart race like you're running on a treadmill. We might do an echo for it. We're checking your cholesterol, we're checking your sugar, and we're trying to be heart healthy. So I only have a little bit of time left, and so I'm going to do one of the other things. Anorexia in our community, it's not that it doesn't exist, but it is so much rarer. And part of that is because if you were thin in Rocky Point, North Carolina, 2 generations ago, it was because you were poor, because you were a farmer and you couldn't feed yourself, so you were in real trouble. So that has never been our body type, that we've never found that good looking. We still, though, have to work on these things. And so, yes, we're never going to be that rail thin because that's just not us, but we can be healthier. When you go to that church supper, I want you to be the plate that they kind of look at you because you've left a little piece of chicken, a little bit of the mac and cheese, a little bit of the greens, and they can't just stack them up at the end because your plate has too much stuff on it just to stack. Because that's when you know that you're actually being more conscious and purposeful in your eating rather than cleaning your plate. And moms and grandmas, don't make us clean our plates anymore. I mean, as I told my grandmother once, and it almost ended me, I said, how does my eating this help those children in China? Yeah, and happily my parents said, you don't have to finish that. So these are the kind of small steps that we can do to make ourselves healthier and happier, because for all of you people who didn't know your grandparents, your grandkids should know you. It should be this intergenerational thing, and we have that option. So I just want to end there, and I want to thank you very much for having us.